Hello, everyone, and welcome to 3 o'clock with SOC. Give me just a second so I can welcome those who want to access the program in Spanish to our conference call with Spanish interpretation. Buenas tardes, muchísimas gracias por estar aquí en 3 p.m. con SOC. Como siempre, ustedes pueden escuchar el programa en español a través de una llamada de conferencia. Y el número aparece aquí en la pantalla y es 646-749-3122 y el código para entrar es 779-328-221. Y ahora les voy a dejar con nuestra querida Marlene, quien va a ser nuestra moderadora de hoy. Thank you for letting me do that. I'm going to leave you in the hands of our beloved Marlene, who is going to be the moderator for today.
Hi, everybody. My name is Marlaina Zara, and I am the Public Health Coordinator here at the Southside Organizing Center. Today, I want to let individuals know that our interpretation line information is in the comments section, and we do have our YouTube and our Facebook pages available to you in both English and Spanish with the pre-recordings from these live sessions that we have today. That being said, I would, it seems like Marlaina Jackson is not here yet, so I'm going to go ahead and share some COVID-19 information with you guys for the time being. So here's a video of current vaccination locations for COVID vaccines. Hi, everyone. My name is Marlaina Zara. I'm the Public Health Coordinator here at the Southside Organizing Center. Give me a second while I share my screen so I can show you guys how and what locations you can go to for COVID-19 testing and COVID-19 vaccinations. So everyone that is 12 years and older is eligible for the COVID-19 vaccine. All 12 to 17-year-olds must have a parent or guardian consent with them when they do go get their vaccine. So a parent should be in attendance when an individual is getting a vaccine, 12 to 17-year-olds. Vaccines are provided for free of charge. Insurance information will not be collected, and thousands of vaccines are available daily. You can get in-home vaccinations now available when you call 414-286-6800 to schedule. So they will come to your home and schedule you an in-home vaccination. There are currently weekly walk-in clinics, so there's no appointment needed. A second dose appointments will be scheduled on the site after you receive your first dose. Please remember to bring your CDC vaccination card to your second dose appointment. Mask wearing and social distancing policies apply when you do go get vaccinated. And please remember your mask and maintain 6 feet apart whenever possible. Locations that you can go to right now include the Milwaukee Health Department's community clinics, which is the Northwest Health Clinic and the Southside Health Center. Both are open Monday, Wednesday, Friday, 10 a.m. to 4 p.m., and Tuesday and Thursday, 12 to 6 p.m. The first one, the Northwest Health Center, is located at 640. All right, I guess that cut out. Interesting. So those are some of the locations, and I can definitely put the link in the comments section for you guys on where those locations are. I want to let you guys know about the COVID-19 committee that we have. So we're having one on the 26th, and when you participate, you can be put into a raffle to get a $50 gift card. A $50 gift card for Walmart. So what you would do is you would come and attend our session the whole time, and you would participate with us and like share your ideas of what you think we should be doing moving forwards with our COVID-19 vaccination efforts and health education and campaigning. And through that, we can work together to create these new ideas and new events moving forwards, right? So that being said, I want to go ahead and let individuals know that, that's this Saturday at 1 p.m. So I hope you all can make it. You can register. We'll put our registration link for that in the comments section. I do want to let individuals know that all residences ages 12 and older are now eligible for the Pfizer COVID-19 vaccine. MPS vaccination sites are available citywide, and you guys can access those by going to city.milwaukee.gov/COVIDvax. And then I also want to let individuals know about this upcoming MPS reminder that the Department of Nutrition Services is committed to providing healthy meals at no charge to anyone age 18 and under throughout the school year and summer months. So summer meals will only be available for families that pre-order in advance, and families can begin to place their orders by going to mpsmke.com/meals. If you have any questions regarding the meal program changes or assistance with the pre-ordering of the meals form, you can call 414-475-8370. So that is very important to know, especially if you're having your family, your children in MPS summer meals this summer. So that being said, I want to go ahead and let you guys get familiar with the CDC website. So one thing that I'm going to show you is the CDC data tracker. And let me share my screen real quick. So hopefully you can see this. So what you do is you go to covid.cdc.gov/covid-data-tracker/#vaccinations. We'll put that link in the comment section for you guys, so you don't have to worry about finding that. But I want to go over the current number of vaccinations that have been distributed in the United States. So in the United States, we have a total of around 178 million individuals have gotten their first dose of their COVID-19 vaccine, and 151.3 million people are currently fully vaccinated in the United States. So that is pretty amazing. And then when you scroll down here, you can click on like our state, and you can see how many individuals have been vaccinated from Wisconsin. So the total doses administered are around 5 to 6 million. And then the total doses administered per 100,000 people is 99,000, around 99,000 people. So that's very good. And I also just attended a live Department of Health Services update with individuals from the Department of Health Services, and we have some updates for you guys regarding the pandemic and current numbers. So essentially, the current update is that numbers are down in Milwaukee. And the deaths are primarily in those that are not vaccinated. There are currently like very low numbers of cases, but we still are seeing those with serious complications that are being hospitalized. So in the past week, there have been 46 hospitalizations and 1 death. And then for children, there have been 9 total hospitalizations and 5 deaths from children. There has been a decrease in the transmission rate. So there's a transmission rate of 0.9%, which is really high compared to 2%, which we were at earlier in the previous months. And then testing capacity is at its highest level that it's ever been. More recently, we're seeing around 11,000 tests per week. So that is high, compared to other cities and states, but it is lower than what we started with in March and April. And then Director Rausch from the Department of Health Services also shared that reasons why we are having low COVID-19 case rates is because of personal choices. So there's been a tide in the way that we're moving in the pandemic. Hand washing is still important. Those that are vaccinated do not need to wear a mask in public, but you can choose to wear a mask in very crowded areas. We know that COVID-19 does give some immunity, so don't think that just because you have had COVID-19, you do not need to get the COVID-19 vaccine. You might have immunity for, let's say, for example, you might have immunity for the current COVID-19 virus, but if there are other variants that arise, you will not be immune to those variants. By variants, I mean, if there are mutations in the COVID-19 virus and it changes, you could get COVID-19 again, and you might have severe complications versus getting the COVID-19 vaccine and preventing yourself from having those higher complications in the future. And what the vaccine does is it covers all of those different variants that are, slight, small variants. So, you just need to be careful and take precaution. And essentially, the people's personal choices are the reasons why we are building herd immunity. By that, I mean that individuals that have gotten their COVID-19 vaccine, that was a personal choice that you went ahead and did that. Another personal choice is, socially distancing from individuals that are not like in 2 households. Another personal choice is wearing your mask in public and wearing your mask wherever you go. If you are not fully vaccinated. If you are fully vaccinated, you can go into public spaces without wearing a mask, but it is recommended that you wear a mask in crowded areas if you don't feel comfortable. And so that being said, our goal to reach herd immunity through vaccinations is 70 to 80% of individuals being vaccinated. But Milwaukee is still a little bit under 40%. So we will be getting to that hopefully by the end of the fall. And once that happens, we can be rest assured that COVID-19 will be, under control, and we will have our lives going back to normal. There is also something called the Join Crush COVID-19 Crew. And essentially it is a live session that you can join. I will be putting the link for that to register in the comments section. But essentially it's a learning session for you to attend if you would like to, get to know more about COVID-19 and the COVID-19 vaccine. And also if you would like to join, and then you will get health education information on how to try to convince or educate other family and friends that that do not want to get the COVID-19 vaccine during this time. There's been lots of hesitancy, and the best way that we feel to move forwards with breaking those misconceptions down is to, have, your own family and friends are the ones that are going to be like advocating for that. And that's the only way we can try to get everyone to get vaccinated. There is a new variant on the rise. It's called the Delta variant in Wisconsin, and it's actually jumped to about 20% of cases from prior to like starting off a couple of months ago. This is a variant of concern. What is a variant of concern, you might ask? A variant of concern is a strain of the virus that essentially it's widespread, so it's wide. It can spread very fast. That's essentially what it means. So the variant was first identified in India and is the most contagious yet. And among those not yet vaccinated, it may trigger serious illness in more people than other variants do. And that's based on what scientists have been saying, according to the CDC. And I want to also let you guys know, here is a video on the differences between, you know, a variant of interest, a variant of concern, and a variant of high concern. So give me a second while I share my screen.
On March 16th,
Sorry, this is a commercial.
2021, 6 women were...
Recently, WHO and CDC have laid down the threat level warnings for the new variants of COVID that have been coming up. So there have been 3 threat levels that have been introduced. Those are variant of interest, variant of concern, and variant of high consequences. What is the difference and how they are defined is something that we would discuss today. So the variant of interest is a variant which is found in discrete clusters, and we see a sudden spike or a sudden surge in the number of cases with the variant of with the variant of interest that is there. Now these variant of interest may or may not escape the present immunity, which is either being built by the antibodies or the vaccination that is there. CDC is currently watching 3 of such variant of interest that are there, and therapeutic test may or may not work for the variant of interest. It is yet under development. The next is the variant of concern. Now, variant of concern, as the name suggests, we are really concerned about it. 5 of such variants have been are under study as of now, and these are capable of causing more severe, they can be more contagious, and these are not affected by, or they do not work well with the prior antibodies, which could be either due to a prior infection or due to the prior vaccination that has been there. So, person who had been previously infected by COVID has a probability to get reinfected by the variant of concern. The last one, none of such variants have been identified as of now, but they have yet created a category which is known as variant of high consequence. Now, this is a variant, as the name suggests, the consequences could be severe. So, it could require extremely high proportion of hospitalization, cause much more acute and severe diseases. They would absolutely refrain any kind of antibodies being already developed either by vaccination or by prior infection, and even the antivirals would not be able to work on these variants of high consequences. So these have been the 3 threat levels that have been defined. Now these are the list of some of the genetic variants which have been under studies as of now. The variant B117 has been identified in UK. It is considered to be more contagious. it could minimally evade the vaccine and therefore has been put in the category of high concern. So as you could see, 5 of these variants, 2 from California, 1 from UK, South Africa, and Brazil, have been under the category of variant of high concern. We have recent one from France, Brittany, again under the variant of high concern. However, a numerous of those, mainly from Philippines, England, and Colombia, have been and are under investigation as of now. So those are some of the variants that have been registered, and the mutations have been closely watched for those variants. So understanding the threat levels and the guidelines being issued by CDC and WHO has been very, very important. We would be covering many more interesting lectures for you. Stay tuned. Have a wonderful day ahead.
All right. I hope that made sense to you guys. So there's 3 categories: variant of interest, variant of concern, variant of high consequence. And I will be putting in a link that defines all of those. So the Delta variant is a variant of concern as of right now. And what that means is that this is what it means. It means there's evidence of impact on diagnostics, treatments, or vaccines. So there's a widespread interference with diagnostic test targets, evidence of substantially decreased susceptibility to one or more class of therapies, evidence of significant decreased neutralization by antibodies generated during previous infection or vaccination, and evidence of reduced vaccine-induced protection from severe disease. So there's also like evidence of increased transmissibility, which means that there's like a higher risk of transmitting at a faster rate, and it's easily transmittable. And then there's evidence of increased disease severity. So there's an increase of the disease moving forwards throughout the population. So variants of concern might require one or more appropriate public health actions, such as the World Health Organization or the CDC to report, or local or regional efforts to control the spread. So that means our public health department. And they would increase testing or research to determine the effectiveness of vaccines and treatments against this type of variant. Based on the characteristics of the variant, additional considerations may include the development of new diagnostics or the modification of vaccines or treatments. So current variants of concern in the United States that are being closely monitored and characterized by federal agencies are the ones that she just kind of took a look at in the video. But the main one that we're looking at is the Delta variant in Wisconsin, and currently that has increased by 20%. So there's that. Hello everybody. Hello Trine. Hello. Nice to see you guys participating with us today. And what else do I have for you guys? So tomorrow we actually have a possible guest, Leanna Yang from HOWA, might be coming on. And that is all I have for you guys for today. Leave any questions that you have in the comments section. Let me quickly put in the comment section. Here's the link for the COVID-19 vaccination information. And you'll find all of the data there for any vaccinations that you need, any vaccination questions you might have, and the COVID-19 vaccination rates within Wisconsin and within the United States. So that being said, I leave you with the survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take our quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.